and it will be available online after the webinar is done. So we're going to go ahead and get started, and then at some point, if we need to do any other sort of changes, like Stephanie will get on the line and let us know what those changes might be. For example, if we need you guys to log off and log back in or something like that. But we're hoping we can just really seamlessly fix the max number of attendees and let people log in again within the next couple of minutes. So we're going to go ahead and get started. Thank you so much, everyone, for coming today to the presentation on streamlining enrollment and boosting benefits for seniors and people with disabilities. We had over 300 people sign up for the webinar, so we know this is a really popular topic, and we're really glad that you're all here today. My name is Jennifer Tracy, and I'm the consultant for the Alliance to Transform CalFresh. And next slide. The background about the Alliance, I'm going to share a little bit about the background for the Alliance. We are a group of 7 organizations that work across the state to raise the rate of CalFresh participation overall, with no county below 70% over the next few years. We focus on 4 data-driven strategies that include same-day service, reducing churn, dual enrollment, and equitable access for all. And today we're focusing on a combination of consistent and quick access from our ATC strategies. The Elderly Simplified Application and the Standard Medical Deduction help to reduce churn, for example, by reducing the frequency of recertification. And they also help improve same-day service by allowing greater use of electronic verifications, among other improvements. Our presenters today include Stephanie Nishio from the California Association of Food Banks, Jared Call from CFPA, and Alexis Fernandez from the California Department of Social Services. We're really glad to have these very knowledgeable presenters here today. Jared is going to share background on the unique barriers for seniors and why these new policies are so important. Alexis is going to review the details of the new policy, the changes to be implemented, and how these changes will benefit seniors. She'll also cover some important reminders about medical expense deductions. And Stephanie is going to share the important opportunities for outreach providers to use these changes to engage eligible seniors. At the end, we'll share some additional resources and discuss your questions sent in during the presentation. So for today's agenda, I think we could go to the next slide. The webinar is going to be recorded and posted at transformcalfresh.org. I know that's a question that many of you have, and definitely will be a question for a lot of people that haven't been able to participate in this part of the webinar so far. And then also, you'll receive an email within about a week or less. If you've registered for the webinar, you'll get that email, or you can always go to our website and find the webinar posted there. Throughout the presentation, you can write any questions that you have using the toolbox on the right-hand side of the screen. It looks very similar to the one that's presented here on the slide. And we'll answer those questions during our Q&A session after the presentation. So before we get started, we wanted to get a sense of who is with us today, who are the lucky 100 people who were able to log in. We have a poll to find out from each of you where you're from, so you can click on the descriptor that best fits your role in the CalFresh community. And it looks like we have a good number of you responding. About half of you are CalFresh advocates or application assisters. We have a number of you that are advocates for seniors in particular. About 20% county CalFresh administrators. There's folks from CDSS and the USDA. And then there's also about 16% of our guests today are mystery, the other category. So we're glad that you're all able to be with us today. Thank you. And at this time, I'm going to pass things along to Jared Call from CFPA.
Thanks, Jen.
And really,
Okay.
Jared, before you start, Stephanie, do we have any updates on the webinar yet?
I think she's still working on it.
Okay, great. All right, Jared, go right ahead.
Okay, thanks. Thanks, Jen. I also want to thank Stephanie and Alexis, our co-presenters today. I'm going to talk a little bit about the context of senior hunger in California, and then touch on how these new policy changes that will be implemented on October 1st can help overcome some of the significant barriers that seniors face when trying to access CalFresh. And so as I'm sure folks participating on the webinar today know, hunger, and in particular hunger among seniors, is a significant problem in California. And along with the rest of the country, we have an aging population. And as the population ages, we're hearing more and more and seeing more and more low-income seniors in California that are reporting that they are food insecure. Looking at some of the data, the number of food insecure low-income seniors in California from 2001 to 2014 actually doubled. So that now, or as of 2014, the most recent data we have, about 1/3 or 31% of low-income seniors in California reported being food insecure. Given, as we said, the aging population and the high cost of living in our state, the problem of senior hunger is only going to grow if we don't work together to address it now. So though these trends and statistics are concerning, we know that addressing senior hunger through CalFresh, or SNAP, as it's known federally, can have positive effects on senior health and on healthcare costs. A recent study by the journal Population Health Management in Maryland showed that in that state, where they did recently increase the minimum SNAP benefit for seniors by $14 per month, SNAP participation reduced the odds of hospitalization for that group by 14%, and reduce the duration of hospital stays if they were admitted. So, and among those SNAP recipients in the study, every $10 increase in monthly SNAP benefits further reduced the odds of additional days in the hospital, which of course reduced overall healthcare costs. So we know that SNAP can help address food insecurity and other associated health problems for seniors. So if we can go to the next slide. So given what we know about senior hunger and how CalFresh can help, we need to look at why senior participation in CalFresh is so low. It's only about 18% of those eligible, according to the most recent data, and that's compared to a much higher rate, though low compared to other states, of 70% or so overall. So there are several reasons for low CalFresh participation among seniors, but three of the main ones that have been identified are listed here: misinformation and stigma, a complicated application process, and the low average monthly benefit that many seniors qualify for. So we'll take these one by one. Actually, back to the last slide, I've got a little more on that. So on the misinformation and stigma, a lot of seniors are misinformed about the eligibility requirements regarding the asset test, owning a car or house, or just the general entitlement nature of the program. Even though seniors do commonly utilize government assistance, whether it be Social Security benefits, Medicare, Medicaid, they sometimes may distinguish CalFresh or SNAP as a form of welfare or public assistance that's separate from those other trusted government programs, and that distinction may deter them from applying. Many seniors may feel and express that other people need this benefit more than I do. And the second barrier that we've identified is the complicated and sometimes burdensome application process. Many seniors, especially low-income seniors, live alone and might need outside assistance to complete the application. Even though CalFresh has done a lot in recent years to improve accessibility through online interfaces, telephone interfaces, and resources, those technological barriers may still prevent seniors from starting and most importantly, completing the application process. And finally, a low average monthly benefit. Many seniors do have unearned but stable income, which can lead them to qualify for a small monthly benefit. About 15% of CalFresh households with a senior member receive the minimum monthly benefit of $16, and about 1/3 receive less than $100 per month. And so given what we said about the complicated application process, that cost-benefit equation may make some seniors feel like it's not worth it to go through that application and reporting process. So we can move on to the next slide. So now that we've talked about some of those barriers, the good news is that the policy changes we're here to talk about that will go into effect on October 1st can work together to effectively reduce those barriers. In this diagram, we're trying to show that the Elderly Simplified Application Project, combined with the standard medical deduction and effective outreach in the form of targeted messaging and senior-focused application assistance, can work together to make it easier for seniors to apply for and receive and maintain their CalFresh benefits to improve their food security. So I'll go through these briefly because Alexis will go into much more detail about how these policies will change and improve the process for seniors. The Elderly Simplified Application Project makes it easier for seniors to get and maintain benefits by simplifying the application process, lengthening the certification period, and reducing the verification burden. The S, as you'll see, really does stand for simplified in the ESAP. And then the low average monthly benefit barrier can be addressed through the standard medical deduction, which can boost the monthly benefit amount for households with out-of-pocket medical expenses. And Alexis, again, will go into more detail. But basically, instead of calculating and needing to verify every actual medical expense, the SMD can provide applicants with a higher standard deduction as long as they can verify expenses over a $35 threshold, which, of course, reduces the paperwork burden and the verification burden for applicants. And then finally, the barrier of misinformation and stigma is really where outreach partners can play a vital role in educating seniors about the way CalFresh works and how they can get extra help to pay for groceries and put healthy food on the table. Stephanie, who's the outreach expert on this webinar, will provide more details and examples of the kind of effective outreach strategies that we'd recommend later in the presentation. So now that we've talked a little bit about the barriers that seniors face and the basics of how these policies and effective outreach can help, I'll turn it over to our partners at CDSS to really dive into the details about how they work and how they can help improve the CalFresh customer experience and increase food budgets for seniors.
All right, thank you, Jared. Again, my name is Alexis Fernandez, and I'm the CalFresh Policy Section Chief at the California Department of Social Services. First, a big thank you to the Alliance to Transform CalFresh for hosting this webinar, and Jared for providing the context for why the department has also identified increased senior CalFresh participation as a priority. As was already mentioned, we've done quite a great job recently of reaching more eligible seniors than ever before. We've more than tripled the number of seniors participating in CalFresh over the last few years, but we still have a long way to go, especially as the number of low-income seniors across the state continues to grow. So the good news is that we've seen other states make strides serving their eligible senior population, and we can apply many of the same policy and outreach lessons learned here in California. To this end, we launched a California Senior Participation Initiative here at DSS, which includes some of the very lessons learned from those other states. Today, I'm going to talk about two components of the initiative, the Elderly Simplified Application Project, or ESAP, and the Standard Medical Deduction, or SMD. I'll provide a general overview of each and discuss implementation details. And of course, as questions come up, please do feel free to enter them into the question box. Not only will we get to them at the end of the webinar, as many as possible, but your additional questions will continue to guide our work, and we will be doing follow-up with folks to make sure that those questions get answered. So jumping to the next slide, I'm going to start with an introduction to ESAP. We're going to go into some detail, and then I'll spend the second half of my time with you today covering the standard medical deduction. So what is ESAP? ESAP is a federal demonstration project made available to states by USDA FNS. A demonstration project allows states some program flexibility, and in return, the state commits to evaluating the results of implementing that flexibility. So far, 8 states, including California, have approval to implement an ESAP. ESAP eligible households include those CalFresh households that only have elderly and/or disabled members and no earned income. The addition of disabled Californians is a unique feature of California's ESAP. We decided that we would like to see that simplification extended to our CalFresh households with disabled members, so went ahead and requested that special permission from USDA FNS. California's ESAP has 3 components, which we'll discuss in more detail shortly. For the high-level overview, it eliminates the requirement for a recertification interview, allows counties to use existing data matches for verification to the greatest extent possible, and it extends the certification period for 36 months to ESAP-eligible households. The ESAP implements beginning October 1, 2017, and our approval goes through September 2021. Next slide, please. So before we jump into the details, I want to highlight a few of the reasons why California pursued ESAP. We've learned from other states that the ESAP components we will be implementing greatly reduce barriers that hinder participation, streamline the application process, and help households retain eligibility once they are already participating. The ESAP is particularly impactful when combined with the standard medical deduction, which we'll be discussing in a few minutes. Together, the ESAP and the standard medical deduction further reduce verification requirements and, on average, increase benefits for households with elderly and disabled members. Next slide, please. So let's spend some time walking through each of the ESAP components. With regards to the recertification interview, normally CalFresh households are required to complete an interview at recertification. This requirement is waived under ESAP. ESAP-eligible households do not need to complete a recertification interview at the end of their extended certification period. With regards to simplified verification, normally CalFresh households are required to verify household circumstances. ESAP waives the requirement that households verify income, household size, residency, identity, and shelter expenses unless they are questionable. Instead of the household providing these verifications, the county will use existing electronic verification to the greatest extent possible. So again, just for clarity here, it's not that the requirement to verify the circumstances has been eliminated, but rather the default to electronic verifications unless questionable. And of course, if an electronic verification is not available for some reason, we would follow up with the household to make sure that that's been secured. Non-citizen status and medical expenses that exceed $35 must still be verified by the household. On to the 36-month certification period. As I'm sure you're aware, most CalFresh households are certified for 12 months. We also have the option to extend certification periods to 24 months for elderly or disabled households. ESAP takes that flexibility a step further, allowing counties to grant a 36-month certification period to ESAP-eligible households. Next slide, please. So, as I mentioned, the ESAP is effective October 1, 2017. A couple of details to highlight as we head toward this very important date in our minds. As of October 1, existing households, so those households that are already on the CalFresh caseload, will transition to ESAP at their next recertification, while new households that are eligible for ESAP at application after October 1st will be assigned the 36-month certification at the time of their application. Regardless of whether a household is existing or new, they will be informed that an interview is not required at their next recertification. With regards to verification, counties will use those existing electronic data matches to confirm as many household circumstances as possible. And once a household has been determined eligible for ESAP and has been placed on a 36-month certification period, they will complete a SAR-7 at 12 months and 24 months. I'd like to now highlight a pretty important point. This is a note on implementation. If a household that was originally determined eligible for ESAP, remember, that's a household with only elderly and or disabled members with no earned income. If that ESAP eligible household experiences a change in circumstances, such as the addition of a non-elderly or disabled member or the addition of earned income, that household is no longer eligible for ESAP. When the county is made aware of such a change, they will convert the household back to non-ESAP on the back end, and they will inform the household that they will now need to complete an interview and that their SAR-7 reporting cycle has changed. Instead of every 12 months, those households that are now non-ESAP eligible will report every 6 months, as is current policy. The 36-month certification period will always remain, as we do not shorten certification periods once they've been assigned. Okay, if we can go to the next slide. I'm now going to spend some time talking about the standard medical deduction. Like ESAP, the standard medical deduction, or SMD, is another program flexibility allowed by USDA FNS. The SMD allows CalFresh households that include at least one elderly or disabled member to deduct a standard amount once they verify at least $35 in medical expenses. Currently, 19 states implement a standard medical deduction. California's standard deduction will be $120 beginning October 1, 2017. While ESAP and SMD work best together, an important point to highlight is that the standard medical deduction is available to households that are slightly different from ESAP households. Households with at least one elderly or disabled member can deduct medical expenses, whereas ESAP eligible households are those with only elderly and/or disabled members and no earned income. Obviously, there is overlap in the two populations, but more households will be eligible for the standard medical deduction than those eligible for ESAP. Next slide, please. So what are the benefits of implementing a standard medical deduction? Generally, the SMD increases utilization of the medical deduction by reducing verification requirements. More households are likely to take advantage of the deduction with the reduced verification burden. Additionally, increased utilization of the deduction generally causes an increase in benefits amongst households who are claiming the deduction. We anticipate that in California, the SMD will result in an average benefit increase of about $22 a month among eligible households. This is considerable in terms of a benefit boost and helps dispel the myth that many seniors may only be eligible for the minimum CalFresh benefit of $16. Next slide, please. Before we jump into the SMD implementation details, I'm going to quickly remind folks about how the medical deduction works today as a point of comparison. Today, households may deduct actual medical expenses above $35 per month. So, for example, if a household provides receipts showing total monthly medical expenses of $50, the household will take a deduction of $15 per month. If the household had provided receipts showing total medical expenses of $100 per month, the household would have taken a deduction of $60 per month. In comparison, the standard medical deduction allows households to verify medical expenses between $35 and $155 to take the standard deduction of $120, regardless of the value of their verified medical expenses. And we're going to have a visual that will help communicate these key numbers, as I recognize it can be a little bit complicated. So the high level here is that under the standard medical deduction, counties will assume medical expenses of $155 and provide households a standard deduction of $120. Households with actual medical expenses that are above that amount may continue to verify and claim those actual expenses. So if there is a household out there that has relatively high medical expenses and they can verify those expenses, they are able to continue deducting those. Note that the standard deduction amount is not anticipated to change over the period of the project. The standard deduction will remain at $120 between October 2017 and September 2021. So if we can go to my next slide, this quick reference table I find to be very helpful, even though it's pretty basic. You'll see here, as a quick overview, if a household does not have verified medical expenses of $35 or more, so it's under $35 a month, then they are not eligible for the SMD. or the regular deduction for that matter. If a household has monthly verified medical expenses between $35.01 to $155, they are eligible for the standard deduction of $120. Lastly, if a household has over $155 of monthly verified medical expenses, they can always deduct actual expenses. Okay, next slide. So now that we have a handle on the key dollar amounts and how they apply to SMB, let's get into a few additional implementation details. So as of October 1, 2017, households with at least one elderly and/or disabled member will be informed of the availability of the standard medical deduction at application and recertification. They will be encouraged to verify medical expenses at application or recertification, but will also be made aware that they may report medical expenses and claim the deduction at any time. Existing households with verified medical expenses between $35 and $155 already on file with the county, so those cases that are already CalFresh recipients, they already have medical expenses verified, will be automatically converted to the standard medical deduction within 3 months of October 1st. This will occur via a batch process and will not require the household to take any additional action. As a result of the conversion, many of them will experience an increase in benefits, and that will happen automatically with the conversion. Next slide, please. Okay, let's talk now about verification requirements, and this is really where we're going to spend quite a bit of time. I've already mentioned that households must verify medical expenses of at least $35 a month. In just a minute, we'll highlight the range of allowable expenses that can be verified, but before we get to that, I want to highlight two important points. Once verified, additional verification is not required at recertification unless the expense is questionable or the household would like to claim actual expenses. So again, once you've verified your medical expense, you do not need to verify that expense again at recertification. This is a great feature of the standard medical deduction. This implementation approach reflects the fact that elderly and disabled recipients are very likely to continue incurring medical expenses over time. This allows households to consistently maintain the deduction. Lastly, we want to emphasize the importance of encouraging clients to report and claim as many medical expenses as they can. This is important for clients as they may have actual medical expenses over $155, but it is also important for the accuracy of the demonstration project in the long term. The state will be permitted to revisit the amount of the standard deduction at the end of the project period and evaluate whether an increase should be considered. Additionally, the state must maintain cost neutrality when implementing the project. We cannot do either without a good sense of what amount of expenses households are incurring and what they are claiming. So we encourage a balanced approach. Verify as many medical expenses as possible, especially if the verification is easily available, but do not overburden households with requests for verification that they may not have. Remember, households will remain eligible for the SMB with $35.01 or more of verified expenses, but claiming as many expenses as possible is beneficial. Next slide, please. So as we head to the wrap up of my presentation, or my portion of the presentation, I want to talk a little bit about what expenses can be claimed. You want to encourage clients to claim as many medical expenses as possible, and in order to do that, you really need to be specific about the range of medical expenses that can be claimed. Providing clients specific ideas for expenses incurred might make them realize that they have more expenses to claim than they had even thought themselves. I've provided on this slide a short list of allowable expenses to give you a sense of the range that can be claimed. Remember, all expenses being claimed must be documented. Now I'm just going to go over a few notes to get you thinking yourself about how you can encourage folks to verify medical expenses. Medication prescribed by a licensed practitioner, so a doctor or a dentist, that can be an expense. Over-the-counter medication approved by some licensed practitioner or other qualified health professional, so a doctor or whatnot, can also be claimed. This includes over-the-counter medications such as insulin for diabetics, aspirin for folks with arthritis, vitamins, creams, and ointments to treat skin diseases, creams and powders related to foot care, so really quite a few over-the-counter medications that are allowable. Public or private transportation is an allowable expense, and that includes transportation to and from a doctor's or medical office, to and from a pharmacy to fill prescriptions, or to a medical supply store to purchase medical supplies. Speaking of medical supplies, those are also eligible expenses. Anything from diapers to linens, hospital beds, portable oxygen tanks, even just in terms of thinking creatively here, a good example is the cost of a typewriter that is equipment connected to a telephone for someone who is hard of hearing or deaf, purchase or maintenance of a lifeline service that is used by an elderly or disabled person in case of an emergency. So definitely there's quite a range of allowable expenses as long as they relate to your medical care and there are costs that are incurred and can be verified. That's definitely something you want to consider. Now, of course, there are some ineligible medical expenses that are worth highlighting. Special diet expenses, so things like Boost or Ensure that can already be purchased with CalFresh benefits are not allowable. Premiums for health and accident policies, medical expenses that are already reimbursed by insurance or other public or private sources are not allowable. Medical marijuana prescriptions are not allowable. Medical bills paid prior to the month of initial application, so on a cost that was not incurred in the month of application or moving forward. And vitamins or supplements unless they've been prescribed by a physician. So I'm going to stop here with my long list of allowable medical expenses, but it just highlights how many things there are to consider. I'm going to transition over with just the last words, if you will. In the lead up to October 1, 2017, we hope that our partners are familiarizing themselves with these new options and thinking about how they will communicate these changes to clients. This is really a great opportunity to encourage seniors to apply. The program is changing for them. We want them to apply. We've been hard at work with our county partners planning for implementation, and as always, we're available to answer any questions you may have. On the next slide, I've included my contact information. I've also included Simar Vinayak's contact info. She is the lead analyst for all things seniors and is available to answer any questions you may have. So with that, I'll thank you again for hosting us and look forward to working together with everyone on the line to increase California's senior access to CalFresh.
Thank you, Alexis. Thank you. That was really great information. Really quickly, I just want to jump in to let people know that we're not able to resolve the technical problem that's preventing some of you from seeing the slides. However, I do know that it sounds like many of you are listening in, which is great. And again, we will have the slides available with the recording pretty soon after the webinar. So I just wanted to share that update with folks, and then I'm going to pass it on to Stephanie.
Hi, everyone. This is Stephanie. I am here to talk to you about next steps for CalFresh Outreach. So there are three main things that we think that you should try to do as we get ready for this change that's coming October 1st. The first one is to get familiar with the changes. So you'll want to know who's impacted by these changes, so you know which households can use ESAP and SMD. You should talk to your county to find out how their business practices may change so that you can tell clients what to expect and what their next steps might be. And then also review allowed medical expenses so clients can maximize their deductions and boost their benefits. The second thing is to get connected with organizations serving seniors and people with disabilities. These could be senior housing sites, area agencies on aging or HICAP programs, AARP, seniors market senior farmers market programs that have market match, pharmacies and clinics, Veterans Affairs, Adult Protective Services, or home visit nurses, or any other organizations in your communities that serve these populations. And then last, of course, we want you to get the word out. So make sure that you tell your partners and your clients that getting CalFresh is easier, getting it and keeping it is easier than it's been. So Alexis did a good job talking to us about ESAP and SMD. So we're just gonna focus a little bit on the medical expenses, although she went over quite a few of those as well. So it'll be important for you all to work with clients to identify and verify their medical expenses so that they can maximize the medical deduction. You want to make sure that you're using clear, simple language when talking about possible expenses, because sometimes it can get a little jargony. And then if your clients don't think they have $35 in medical expenses, it might be helpful to give them some examples that they haven't thought of. So as Alexis mentioned, you might talk about prescription eyeglasses, transportation, service animals, dentures, hearing aids, things along those lines. And then, of course, we don't want to stop at $35. If your clients have medical expenses over $155, then it'll be really important to verify those so that they can get a larger deduction and more benefits. And we want to make sure that we are getting connected with organizations in our communities that are serving seniors. So if you don't already have good partnerships, then you'll want to go ahead and establish those. And if you do, you'll want to make sure to strengthen them. Go to places where seniors are, like senior housing sites, places where they might be comfortable and close to home so they can get verifications if needed. Settings with social aspects like congregate meal sites may not, or just may be challenging due to the social aspects of them and the stigma related or associated with the program. So you might just want to just really think about where you're going. You know, we talked a lot about, or I talked a lot about organizations that serve seniors, but you might also consider some non-traditional partners like schools in case there are grandparents who are taking care of children. They may be eligible as well. And then also a good tip is to be consistent in where you go and when you go so that you can build rapport with people. And folks will, if they feel more comfortable with you, may be more likely to apply. And then lastly, just keep in mind that people may have perceived barriers that you'll need to address. For example, folks may think that food or that CalFresh still comes in stamps, that they're taking benefits from others or families with children, or that it's not worth the amount. So you'll want to be prepared to let people know that CalFresh comes on a debit card. Remind folks that they've already paid into the system and that everybody who's eligible for CalFresh can get it. And then also having a visual of how much the minimum can purchase is also helpful. Although with the standard medical deduction, we hope that people will be getting well over the minimum. Oh, and it would be, if your community has a market match program at your farmer's market, it would be great to highlight that as well. So we talked about, you know, some perceived barriers that seniors may have. So when you're talking to seniors about CalFresh, you'll want to stay away from the term welfare and try to use messaging that addresses their concerns and emphasizes saving money. So this is another great spot to talk about the market match program, where they may be able to double their CalFresh dollars. It may help to frame CalFresh as a monthly coupon that people can use. And we've got some other ideas as well that we'll be sharing after the webinar. My colleague Edith developed a tip sheet that spotlights the way that 2 of our partnering organizations are working with seniors in their communities, and we'll make that available when we post the webinar. And I'm going to go ahead and turn it over to Jared for more on resources.
Sure. Thanks so much, Stephanie, and thanks, Alexis. So we just included some resources here, first from some national partners. The National Council on Aging has really great resources on effective senior outreach and ways to partner with senior-focused organizations along the lines of what Stephanie just outlined. And they also published, in conjunction with Benefits Data Trust recently, the Advocate's Guide to the ESAP, which is a really comprehensive resource for learning more about how to maximize the benefits and effectiveness of that simplified application and recertification process. And then CDSS obviously has great resources on their website. And if we go to the next slide, there's a link to the actual outreach medical deductions checklist that we've been referencing, and also the all county letters implementing the ESAP and SMD starting October 1st. So we hope people will take advantage of these great resources that CDSS has, and also that the great national partners at National Council on Aging and Benefits Data Trust have put out there. Thanks.
All right, so we are going to open it up for questions. So you should see a chat box. Do you want to take it over, Jen?
Yeah, I can. But yeah, so as Stephanie was saying, there's the chat box that has the option for adding in questions, and I've got a number of questions here. There's a number of questions I'll start with about medical costs. One of them is about the details regarding service animal costs. And it's my understanding that the costs for service animals would include any veterinarian bills, the cost for food, and the cost of purchasing that animal itself. But Alexis, do you want to clarify anything about the allowable deductions related to service animals?
No, that's correct. I would emphasize with that expense, like any other, as long as it's reasonable and tied to a medical condition. So the service animal is, I don't want to use the term prescribed because that may not be the right term, but it is a service animal that the person has acquired due to a medical condition, then that is an allowable medical expense.
So they might need to be able to document that to the eligibility worker that it's related to a medical need.
Well, that would be the case for any of the allowable expenses. In order to, and I imagine that with a service animal, you may be able to claim expenses above $155 a month because of the cost of maintaining the animal. Then you would need to have the verification for all of those expenses. But at the least, if you brought in more than $35 showing that the service animal expenses are above $35, then you could claim the standard amount.
Got it.
And Simmer is letting me know that there is an administrative notice on this topic from USDA FNS, and we can follow up with a link to that for folks so that you can get additional guidance on the topic.
That would be great. There's a question about if the Medicare is being taken out of their checks directly, is that considered a medical bill?
So I'm going to pull up my slide here, because if it's a premium for health or an accident policy, that is not allowable. Or if it's an expense that has already been reimbursed by the insurance or some other public or private source, it's not allowable expense.
Okay. If the senior reports a one-time medical expense and they no longer qualify for the standard medical deduction at some point, would this initiate an overpayment?
No. So the way that medical deductions are calculated, we have a few options for doing that, and I'm just pulling up my notes. You can either count monthly expenses over the certification period, or if you have fluctuating expenses, you can average those out over the certification period to come up with a monthly expense. So especially for something where there's like an interval between the billing. There's also a one-time expense that can either be averaged over the certification period to come up with a monthly expense. So let's say that you have a $1,200 medical expense. You can actually average that to $100 per month of incurred expenses, or you can choose to take a one-time deduction. So there are a variety of ways in which the expenses can be calculated to get you to the $35 per month minimum verified expense.
And if they incurred that one-time expense where maybe they had to prepay for something before they applied for CalFresh, would they be able to do that deduction that you're talking about where it's spread out over the month?
No.
Since they're receiving a service?
No, the deduction is for payments that you're obligated to make or expenses that will come up over the cert period. If you've already paid off a bill before application, then you're not able to use that expense.
No, I mean if you prepay for something, like let's say you prepaid for a walker that you continue to use, or you prepaid for a service that you continue to receive, but that payment went through before you applied, but that payment is being applied to services that you're receiving while later on while getting CalFresh, would it count or not count?
I mean, it's a very scenario-based situation. In general, if you have the receipt for the expense being incurred, now, if you incurred an expense for a walker 2 years ago, that is not, the rule is not going to apply here. But if you have a receipt from a walker, for example, that you purchased within the month of application, it is allowable.
Okay. Let's see. There are a lot of questions about the medical expenses. Let me see if I can go through and pull more of these out. Many seniors aren't sure if they're getting SSI or not, as many get a mix of SSI and regular Social Security retirement. Is there an easy way to help them find out?
I mean, the county is always available to help an individual determine whether they are on the type of SSI that would make them ineligible, and that's any SSI here in California. Recently, we had some policy clarification about SSI recipients that are in non-pay status. So remember, when you walk in to the county or call the county, they're able to check your eligibility. In particular, they have access to the SSI enrollment information through the MEDS database, so they could check it at the time of application. Otherwise, I really think that's something that folks either know or don't know, and I don't have a quick reference tool.
Okay. Could you speak really quickly on ways somebody could document a transportation cost?
Sure. So what you would do is show that you made it to a series of appointments or out to the pharmacy, and then the worker would work with you to figure out what the mileage on that, the distance that was traveled. They usually will apply the IRS mileage reimbursement rate, which is something like 17 cents per mile. It changes on a year-to-year basis, so don't quote me on that. But based on the distance and the mileage rate, the worker and the individual would come up with an estimated cost of transportation. Now, there's also private transportation, so there are any receipts for taxis, Ubers, other rideshare services can also be used under the category of transportation.
Great. There was also a number of questions about the application and certification timeline. Could you just briefly go over that again, Alexis, about when in the process, after someone applies and is granted, at what point would they need to be in touch with the county again, and at what point would they have to do a recertification?
For the ESAP or for the standard medical deduction?
For the ESAP, if someone qualifies as
Sure.
an ESAP household, at what point would they need to do like a SAR-7 and then the recert and stuff?
Great. So if that application you are determined to be ESAP eligible, then you will be assigned a 36-month certification period, and you will have a SAR-7 due every 12 months. So You apply, you're determined ESAP eligible. Your first SAR-7 is due at 12 months. Your second SAR-7 is due at 24 months. And your recertification is due at 36 months, but it does not require an interview.
Excellent. And just a reminder, we're getting a lot of questions about SSI in California. Those who receive SSI in any form are not eligible. So it doesn't matter how many medical expenses they have, they won't be eligible for CalFresh. And there's a number of questions about the types of things that can be deducted. And I don't think we have time to go through all of those details again. There are links to the guidance that go into detail about what types of medical deductions are eligible. So I encourage you to look at those links again. And then if you still have questions, you can always use the SNAP listserv to ask them, or reach out to Stephanie or whomever your contact usually is for policy questions like that. Let me see if there were any. Stephanie, were there any other questions that you were saying that? Oh, there is a question about if there's going to be, if the state will make available flyers for outreach to order and share in their community.
So about ESAP or standard medical deduction specifically, I assume?
Yes, about this new policy for outreach to seniors.
So that's a great question, and we've, just to be fully transparent, have been very focused on making sure that the implementation and automation details are in place in the lead up to October 1, but have already started to work with our outreach staff here at DSS to think about what materials are most effective in terms of communicating the changes to clients. So that's to come, though not, tomorrow. In the short term, we're working on those next.
Great. I think you covered this, but just as a reminder, if there's an ESAP eligible household currently receiving CalFresh, what happens to them on October 1st?
So likely nothing, because only if their recertification is due on October would they experience a change. For households that are with us already on the caseload, we would convert them to ESAP at the time of their next recertification. So the reason we made this policy decision is you may have a household that is ESAP eligible who just recertified in August, and they've been assigned a 24-month certification. We thought it would be very confusing to communicate to them shortly after their recertification was complete that things have changed without really having the opportunity to talk to an EW or a county staff during the interview process or during the recertification process. So what we decided to do was the next time that household is eligible for recertification, which would have been 24 months from August, that is when we will, quote unquote, convert them to ESAP and eliminate the recertification interview requirement, assign them to 36 months, and so on.
Great. How is CDSS planning to track success or hiccups in the implementation?
That's a great question. So by nature of both of these policy initiatives being demonstration projects, we do have several evaluation reports that are due to USDA FNS. So we will be working with our counties to set up the data requests so that we can fulfill those reporting requirements. I believe we have a report due every year for the length of the two projects. And then we'll be just tracking automation closely as well to make sure that the systems are set up to track policy, and we'll be looking at that over time. So for this particular project, have some, I think, good requirements to report so that we're able to track that over time. Great.
There's a question about the expected benefit increase. Right now, the average or the minimum benefit is about $16. Is it expected to go to $22 or to $38?
So I think this is an important point. I'm going to take a moment to let me take a step back here. The minimum benefit is $16. On average, currently participating households that include a senior that's a person over age 60, receives significantly more than $16. And I wish I could, don't quote me here online, but it's over $100 a month. I think it's actually closer to $120 some a month on average for our currently participating seniors. The expected increase as a result of the standard medical deduction is estimated at an additional $22 a month on average per household. So that's on top of the average benefit, which is much higher than $16. And that's basically because we've underutilized that deduction historically. And if we see the uptake that we expect in utilization of the deduction, many more households will be claiming the medical deduction, and more of them will experience that increase in benefits. Of course, it's an average, so some more than others. It really depends on the unique circumstances of the household. But I think this is an important moment to take a pause and dispel the myth that most of our seniors are receiving $16 a month. That's just not the case, particularly those that are participating today.
Got it. There's a question from a county. Will it be a procedural or active error if a county fails to grant a 36-month certification period to an ESAP eligible household?
So I will have to follow up after the phone call with my quality control review hat on. I can't answer that right now off the cuff. But you can definitely get in touch with me. I have an answer for you. I just have to put you in touch with the right person.
Let's see. There's a few more questions that have come in. So there's some confusion regarding the discussion of medical premiums. The MPP says that non-reimbursed health insurance and Medicare policy premiums are allowable deductions, not accident and sickness policies. Only accident and sickness policies are not allowed. But it was stated in the webinar that no medical policy premiums were covered for this SMD. Is this correct?
I'm sorry. That's a good point of clarification, and let me just say this again. So if your medical costs are already covered, you cannot deduct them. So if you don't have out-of-pocket expenses, then those are not deductible because you're not expenses incurred. If you are paying for a health premium out of pocket, you can deduct that. And then there are certain policies, I believe life, accident protection, and some others, I have to look at my notes, which are not allowable. The distinction I was trying to make was if you can only deduct an expense that you've incurred. So if your health costs are covered and you don't make a contribution to that, it cannot be deducted.
Okay. Is the projected decrease in the minimum benefit, this is related to the updated COLAs that came out recently and will be implemented in September or October, sorry. Is that projected decrease in the minimum benefit going to impact seniors?
Sorry, I'm not sure I'm understanding the question. Can you repeat it?
It's my understanding that the minimum benefit, the overall benefit amounts are being decreased with the new COLA, and maybe Stephanie can chime in to clarify if I'm missing something.
Yes. No, the maximum benefit based on household size has decreased, but the minimum benefit, I believe, is at $16. I don't have the COLA letter in front of me. That did not change. And I believe the reduction in the maximum benefit according to the household size would impact all CalFresh households potentially, because it really is a reflection of where households dependent on their size would cap out in terms of benefits. It's not specific to seniors.
Okay.
If that makes sense.
And I just also want to clarify, again, this question has come through a number of times. The expenses that can be, when people first apply for CalFresh, the medical expenses that can be included are expenses that have been incurred within that month of their application and moving forward, but not anything that was incurred in the month prior to their application. Is that correct, Alexis?
That's correct. And then you have some flexibility over how you calculate an expense to to make it a monthly expense.
Right. So if they had a large one-time expense, that could be calculated out over the month for the year or something like that.
Right, but the portion that the person is obligated to pay moving forward. If a medical bill has been paid prior to the month of initial application, it's not allowable.
Okay. Let's see. So just to also clarify, the 6-month STAR requirement is only for elderly disabled households with earned income. And if they have no earned income, they report every 12 months and then have a 36-month recertification. Okay.
That is correct.
Got it. Let's see. We have about 5 minutes left. I'm just seeing if there's any other questions we haven't covered. And I think there was a couple, let's see. Oh, I had a question too. I know on one of the slides you said that the county welfare departments are allowed to grant up to 36 months. Is that a choice that they have if they want to participate in that, or is every county moving to that process?
No, that was just probably a not sufficiently nuanced statement. All counties are on board. We're setting up the programming so that 36-month certification period will be applied to ESAP eligible households.
Okay. And then in terms of the elderly and disabled households who don't qualify for categorical eligibility, they can still get benefits if they meet the asset test?
Sorry, let me take a pause because again, I want to make sure I'm understanding the question correctly. So the household is not eligible for MCE because I just want to make sure I'm not giving out
this was a question I think Jared might need to clarify. It was a question that he sent to me earlier before the webinar. So
that would be great. I just want to make sure I get it right.
Sorry about that.
No, I hate to differ, but yeah, that one wasn't me. Sorry.
Oh, sorry about that. Okay. Let's see. Well, I will skip that question then because I can't fully explain it. So,
Jen, it was me.
Oh, Stephanie, do you want to clarify the question?
Sure. It was just to remind folks that if people are not eligible for categorical eligibility because they're households with elderly and disabled members, because their income is over 200%, it was just, I just wanted to confirm that they are still able to get benefits, the minimum amount, if they meet the asset test.
Yes, and yes, I mean, it seems like it could be above the minimum benefit. I don't know that that's in every scenario the case, but if they meet the asset test and the asset test is imposed because they're not MCE, then yes, as long as they meet the other eligibility requirements, they could still be eligible.
Another clarification, at the 36-month point for an ESAP household, they'll receive a recertification packet, and then do they have to also do an interview, or there's no interview requirement at that point?
No, if the household has already been determined ESAP eligible and assigned a 36-month certification period, there is no interview at recertification.
Got it. And I'm just looking through the last few questions to make sure I didn't miss anything. If somebody stops paying a medical expense but they don't alert the county, what is the implications of that? And is that part of a required thing to report?
No, it's definitely not a required report. We only have 2 required reports under simplified reporting, income over the IRT, and then soon we will have an ABOD reporting requirement. As we talked about, you claim and verify expenses at application or at some point through the certification period, and under the SMD, you do not need to re-verify those expenses unless they're questionable. Now, depending on the scenario, let's say that initially a client came in and had a very high deduction for a one-time medical expense. It may be that at recertification, there's question about whether that expense would continue, but generally, if your verified expenses are things like over-the-counter medications and eyeglasses, we are going to expect that those would continue over time, which is why there is no requirement to re-verify the expense unless it's questionable.
And
so it's tough to answer these types of questions because it really does depend on the specific circumstances of the case.
Got it. And there is some questions about how a questionable expense is being defined. Is there guidance on that being issued from CDSS?
So there is not at this time. The if questionable category is kind of a general category that appears in a lot of our regulations in terms of being allowed to request additional verifications if that would be helpful in determining the expense or whether the expense continues. So that is not something that is defined in black and white in our regulations at this time, and it would be very difficult to define.
Okay. One last question. If there are existing cases with verified expenses that are eligible for the SMD, will those be automatically given the standard deduction for expenses up to $155 and actual deductions for expenses over $155?
Yes. So if you have already on file an expense between $35 and $155, then we will automatically convert you to the standard medical deduction. And if you have actual expenses on file already over $155, we just continue with what you have over $155.
Great. We have reached the end of our time. Thank you, Alexis, for answering all of these questions. I will be saving the questions that have been sent over and going share them with Alexis, because I think there are a few that maybe require a little more research or detail. So I'll send those over, Alexis, for your team to look at. And we really appreciate everyone who's been able to participate today. And those of you that weren't able to log in to see the slides, we're very sorry about the technical problems, but we'll make sure that that is not an issue in the future. Again, the webinar will be posted at our website at transformcalfresh.org. And if you do have additional questions, please reach out to Stephanie Nishio at CAFB or any of our presenters, and we'll do our best to get back to you as quickly as we can. So please keep in mind, this is going to happen October 1st, and we look forward to any support we can give to help you prepare for this transition. Thanks again to our presenters, and have a great day, everybody.